Pharmacy workers in some of Iowa's smaller communities are celebrating the signing of a new law. They say it will help them keep more money on prescriptions they fill without increasing the cost for customers. KCCI's Kayla James spoke with a pharmacy in Colfax. Kayla joins us now. And Kayla, they say this law changes a lot for them.
That's exactly what they said. The law puts restrictions on pharmacy benefit managers, also known as PBMs, and it aims to create a fair reimbursement system. Now, during the legislative session, opponents of the law said it could raise drug prices for Iowans, but supporters say it could keep the only pharmacies in their towns still going.
This will get you better.
The Spring City Pharmacy team in Colfax will tell you there's nothing they love more than helping the patients that come through their doors.
Okay, there you go.
Something they were worried they wouldn't be able to do much longer.
We were making those plans of how do we carefully shut the doors down without deserting our community.
But that was before Wednesday afternoon when Governor Reynolds signed changes into law. The law sets restrictions on pharmacy benefit managers, or PBMs. PBMs negotiate prescription drug prices between manufacturers, health insurance companies, and pharmacies.
It's not unusual to lose 20 cents, lose $10, and there's some we lose $200 to $300 on.
Brad Mag and Brenda Jaden are two of Spring City Pharmacy's 3 co-owners.
In the last 3 years, we've been negatively reimbursed over $100,000. Meanwhile, the PBMs have been making billions and trillions of dollars.
The law requires pharmacies to be reimbursed at the average state or national acquisition cost of a drug, and it aims to create a fair reimbursement system, making it so pharmacies don't lose money on the prescriptions they fill. The law also sets limits to stop PBMs from favoring a specific pharmacy to fill a prescription.
When we reopened these doors, we did it thinking that we would be able to provide a service for our community. It's a service that this town needs. And now with this being passed, we can do that.
Thank you.
KCCI did not hear back from some associations who lobbied against the law during the legislative session, or they couldn't speak Thursday. The Iowa Association of Business and Industry did release a statement Wednesday after Reynolds signed the bill, saying in part, it's disappointed in the action. The statement went on to say the legislation will, quote, drive up the costs of pharmacy services in Iowa without any discernible improvement in patient care, and that Iowans, quote, will bear these costs at the pharmacy counter and in the structure of their health care plans.
In every state that's done this so far, it's decreased the insurance costs and prescription drug costs.
The law goes into effect July 1st.
We believe we won't see the full effect until the first part of January when most of our contracts renew. But we're looking forward to getting some clarification on that over the next few weeks.
In Colfax, Kayla James, KCCI 8 News, Iowa's news leader.